So we're about to go in talking about the pathology of schistosomiasis. We get to look at this beautiful disease condition. All right. We get to see that this disease condition is caused by a type of worm called the schistosoma. We get to look at the various types of these worms. Okay. And we basically look at the types that are important to us, right? Because not all types of this worm cause this disease condition, all right? Just three types actually cause this disease condition. I'll be looking at them, right? So this will be our first lecture on schistosomiasis, and this is basically just me trying to introduce us to the pathology of schistosomiasis, all right? How this disease condition actually comes about, all right? So the pathology, introduction to the pathology of schistosomiasis, right? And let's look at the cell cycle. In a cell cycle, schistosomiasis basically, let me start from here. When you go to waters that are contaminated with the parasite can penetrate your skin, and it goes to your liver, all right? So from there, it go into the intestines, and it can affect the intestine, it can affect the urinary system, it can affect the reproductive system, it can affect the gastrointestinal system, all right? Then later on, the individual pass it out in feces, all right? And when the eggs get to the waters, they get back into the snail and they complete their life cycle, all right? And if another individual comes to the water, they pick up the uh, the the eggs and it penetrates the skin again, all right? That's just a summary of the life cycle. So introduction. We say that schistosomiasis remains one of the most important parasitic infections in the tropic. All right, the most widespread and important trematode. That's a blood fluke in which the body of the male is folded to form what a gynecophoric canal in which the female is carried. All right, this is just to tell you guys that in the matured schistosoma worms, yeah, you see this opening here? That's a gynecophoric canal, all right? And the males actually carry the female schistosoma worms in that gynecophoric canal, okay? So the adult worms are found in the veins, okay? So we're looking at the important species, okay, of schistosomes. I get to see that these three are the ones that are important to this disease condition. These other ones are very rare, okay? So the first one we have what? Schistosoma hematobium, and they are predominantly what in the vesical plexus. We have the Schistosoma mansoni, predominantly what in the inferior mesenteric veins. We have the Schistosoma japonicum, which is in the superior mesenteric veins. And other rare parasites of humans that are of the schistosoma origin to include what? Schistosoma intercalatum, schistosoma what? Bovis, schistosoma matei, schistosoma curasoni, schistosoma capense, and schistosoma what? Mekongi. Alright? So this is it, and this is still talking about the life cycle of the organism, right? So we said that an infection due to blood fluke of genus what? Schistosoma. All right. It is characterized by fever, hematuria, abdominal signs and symptoms, in which severe cases may lead to what? Organomegaly and hepatic what? Fibrosis. Severe cases will lead to organomegaly and hepatic fibrosis. Okay, so the most important species to men, like what I told you guys here, I told you guys the most important ones, the most common ones are the what? Schistosoma hematobium, Schistosoma mansoni, Schistosoma japonicum. All right, these are the most important species to the man. Okay, so guys, that's it about introduction to the pathology of what? Schistosomiasis, right? So I hope you guys enjoyed this tutorial. I'll be see you guys in the next one where we'll be further on talking about the concept of schistosomiasis, right? And from there too, we'll also be talking about the effect of schistosomiasis on different systems of the body. Okay, so guys, that's it, and I'll see you guys in the next tutorial. Bye for now.